Number 5. So, Ranjit has high blood pressure. It's increasing his risk of heart disease. Explain blood pressure measurements, part 1 of the question, and suggest why they might be different or vary between individuals. Okay, the quality of written communication will be assessing your answer. It's a 6 marker. You've done these before. Okay, we'll have a look at this. Let's have a look at the mark scheme and go through this quickly. So, here is the mark scheme. Level 1. Okay, you need to give examples of factors which cause blood pressure to vary between individuals. So explain why people have different blood pressures generally. Okay, things like weight, fitness, age, stress, inheritance, drugs, smoking, the amount of salt they eat, fat, or any genetic variations. And if you just gave some examples, you could get 2 marks there. Okay, but the actual question is in 2 parts. Okay, this and separates them out. First part is explain blood pressure measurements. How do we measure them? Okay, so for 3 or 4 marks, a level 2 answer, explain why they have 2 numbers. And then describe factors as increasing or decreasing blood pressure. So here you just say what might vary. So fat, being fat or being obese, okay, or your age. Here we need to explain how they affect the blood pressure by increasing or decreasing. So for example, you can explain the fact that blood pressure has 2 numbers, and the higher numbers when the heart contracts, squeezes, pumps, and the lower numbers when the heart relaxes. You're going to use the keywords. This is systolic and diastolic blood pressure. Okay. You could also say that 120 over 80 is around a normal blood pressure. You could also explain that being fitter decreases the blood pressure, or eating high salt diet increases blood pressure, or having high fat increases blood pressure. Something along that, explaining or describing what happens to the blood pressure based on another factor. For level 3, which is the closest to 4 marks now, 5 or 6, explain that blood pressure is the pressure of the blood on the walls of the arteries, which is what's going to get you your 6, and explain how they are in highlighted as a how one factor or more affects blood pressure. So, for example, why exercise reduces blood pressure, or how cholesterol deposits increase blood pressure by making them thinner. Okay. If you're not sure about any of these, BBC Bite-Size, your notes will be a good place to have a look. You can, as always, draw little diagrams to help explain your diagram, to help explain your answer if you think that would help.